Hello my friends, my name is Dr. Saeed Kazmi, you watching my YouTube channel. Let's have a quick review of what are febrile seizures. Febrile seizures, as the name says, fever and seizures. So an episode of convulsions which is associated with high temperature is known as febrile seizures. Usually occurs in the age group 6 months to 6 years. Is of two types: simple febrile seizures and complex febrile seizures. Now, what are simple febrile seizures? Simple febrile seizures are when the seizures are associated with the following. Number one, the temperature is usually greater than 38. Some books says 38.5. Number two, the seizures are always generalized tonic-clonic in nature. Number three, the seizures always last less than 15 minutes. And number four, there is always one episode of seizures in a 24 hours time period. Now, what are complex febrile seizures? Complex febrile seizures are when the seizures are associated with the following. Number one, the seizures are usually in most of the cases associated with a high temperature, but sometimes can also be associated with a low temperature. Number two, the seizures are focal in nature. So there is some form of focal neurological signs, either ictal or postictal in nature. Number three, if the seizures they last more than 50 minutes, even then it's a complex febrile seizure. And number four, if there is more than one episode of febrile seizures in a 24 hours time period, that is also known as complex febrile seizures. Now, what is the workup of febrile seizures? Now, if there are simple febrile seizures, usually no workup is needed, except that you have to find the focus of infection. So if your clinical examination shows a focus of infection, you simply treat it. But if you can't find a focus of infection, then you might have to do a little bit of workup to find where the focus is. Like, for example, it might be a UTI, for which you might need a urine dip and a urine culture and sensitivity. If the febrile seizures or complex febrile seizures, then you have to do more workup. You have to find the focus of infection, but you also have to rule out complex neurological pathologies like meningitis and encephalitis. In complex febrile seizures, it's also important that you do an EEG within the first 48 hours, because if there is something associated, like for example, if there are any EEG abnormalities, the chances are more that you will pick it up in the first 48 hours, because after the first 48 hours, the chances or the probability would be quite slim that you would pick up anything on the EEG. Number two, the American Academy of Pediatrics would also recommend these days that in case of complex febrile seizures, you should arrange an outpatient-based MRI by the end of the first week. Why? Because you want to rule out structural brain abnormalities and sometimes some phenomena like medial hippocampal sclerosis, which might be associated with complex febrile seizures. Sometimes it might need a bit more workup, like for example, somebody who has got history of repeated complex febrile seizures, you might want to see if there is underlying Dravet syndrome, which might be causing the complex febrile seizure. So anyhow, this was the brief overview of febrile seizures. Hope you have liked it. It's just for review purposes. Have a good day. Take care. Bye-bye.